Hello YouTube, welcome to my channel. Again, I'm back. I wanted to kind of talk to you about the day of the test, what to expect on the NCLEX. So, like I said before in my earlier video, I graduated from nursing school in December of 2019. I was able to take my NCLEX in February 2020 and I was able to pass it the first time. So once I graduated, they sent my information to the Board of Nursing, and once I had everything already settled, like my background check, once they received all the information from the school, they were able to send me something saying that it was okay for me to go ahead and schedule my test with Pearson VUE. I was able to pay, I think, $200 something to Pearson VUE to take my test. So I scheduled my test for February of this year, 2020. So my test wasn't early in the mornings, because most people are in the mornings, but mine was like at 1 o'clock and I had to be there like 30 minutes early. So I was able to wake up. I did not study much, but I think I still had my note cards with me that I was just kind of reviewing, like my drugs, because that's like my weak spot. I don't like drugs, but anyways, so I just had my little note cards around that I just took around with me, but I didn't do a lot of studying that day. I was able to eat good breakfast, and then I was there like maybe 45 minutes early, and it wasn't too far away from my house, so that was a good thing. But it was so nervous. I was so nervous. But once I got in there, I had to give them my driver license, and then I had to give them my phone. They had to put my phone in a bag and put it in a locker, and I was checked. They checked everywhere, you know, to make sure you don't have anything with you. They check under your clothes, like your arm, to make sure you didn't write anything there, even your ankle. They check everything to make sure you do not have anything with you to cheat. So once I did that, I was able to go in. They showed me the booth that I had to be in. I think I might have had like 10 other people there, but most of those people were probably taking NCLEX, but they're probably taking like RNs or other things that we're doing, but I don't know. So anyway, so they get my computer and the lady says, okay, here it is. You know, you have about 5 hours. But anytime you want to take a break, I think after 2 hours, put your hands up or your hand up, and we'll make sure you take a break. So I was able to, I think I did it for like 2 hours, but man, I was going kind of slow because I was like, man, this is going to be, because I think the minimum is 85 questions, and then the maximum is 205 questions for LPN. So by the time I took my first break, I was probably like 65 questions. So I was kind of going slow, but I was kind of nervous. I'm like, oh my gosh, I don't think I'm going to have enough time to finish this test. So I was able to take my break. And when you take your break, you're not allowed to open the locker to take your phone out, or yeah, I wasn't allowed to take anything on my break because I just went to the bathroom. When I came back, they had to, you know, pat me down again, check me to make sure that I don't have anything. I don't have anything written down on my arms or anywhere on my body or hidden somewhere. And in the testing area, they do have cameras, so they do see you. There's a lady sitting right there, and she can see you. What are you doing? So, so I came back, and all of a sudden, I'm doing my test, and all of a sudden, when I got to 85 questions, my computer just shut off. I was so nervous because I was like, okay, the computer just shut off. Maybe I failed. Maybe I failed this NCLEX. So I called the lady over and said, hey, my computer just went off at 85 questions. She was like, oh, it does that sometime. Either you're doing really bad or you're doing really good. So she's like, oh, well, you'll find out later. I was like, oh, thanks. So anyways, I was able to leave the testing area, and then I called my husband and I said, I'm done. But I wasn't too sure if I passed this test because it wasn't hard, but it was kind of hard. So anyways, when I came home, I checked to see if I passed, but they couldn't give you any answers. So I could pay like, I think $7.95 to get a result very quickly, but I opt not to do that. So I said I'll just wait. So then I decided, then I just waited till the next morning. So the next morning we got a text, and my husband was able to get the text, and then he just handed the phone to me and said, hey, look at the phone. So when I looked, it says, congratulations. That's all I wanted to see. I didn't care what else it said. So it said, congratulations, you have passed the NCLEX for PN. Here is your nurse number, your license number, and I was so excited. So then a few days, like maybe a week later, not even quite a week, I was able to get the official license in the mail that now I'm officially an LPN or LPN. So anyway, so I wanted to kind of do this video to tell you like that day, but there was a lot of questions on there that, hey, you cannot share this with anybody, you know, legally I cannot, you know, tell you what the questions was, but I wanted to do this video to tell you what to really focus on. Again, everybody's test is different. My test had a lot of drugs and calculations on there. So if I didn't know how to calculate the drugs, I would have failed my test. So I had a lot of drug calculations. I had a lot of drugs too on there for different diseases, and I have a few diseases on there too. So like my last video, I was telling you, you need to pay attention to your drugs. And to do that, you don't need to know all the drugs, just know like the endings of the drugs. Let me show you something. So I made this list. I got this list here. You can't see it too well, but it has like, for example, I have my diabetes drugs. I have my rapid acting drugs, Novolog. I have my regular Himalayan R. I have my long acting Levemir. I have Lantus. I have all of these because it kind of helped me kind of remember what the diabetes drug was, and I kind of learned like, you know, the different time frame of each of these medication. Then I have like all my hypertension drugs. I have, let's see here, I have all my ACE inhibitors like the Prils. I have the, let's see here, the Cinepro. The Cinepro is one of the ACE inhibitor drugs for high blood pressure. So I was able to learn that, and okay, remember, okay, every Pril, the P-R-I-L, you know that it falls within the ACE inhibitors category. So I was able to learn that. So every time I saw a Pril, I knew it was an ACE inhibitor, and that was used for blood pressure. And then I have like, I'm just gonna go through this. I have my beta blockers, like which is the LOL. Propranolol. Propranolol is one of the beta blockers, and that is also used for blood pressure. It's a blood pressure medication. And then I have my calcium channel blockers. Nifedipine. Nifedipine is just a drug for it. Dipine, D-I-P-I-N-E. That's the ending. So when I saw that, I knew that was calcium channel blocker, also used for blood pressure. And then I kind of learned my diuretics, and it's very important too because most of the time patients that are on blood pressure medication, they will be on diuretics. So like I figure out my loop diuretics. Furosemide is one of the loop diuretics. I also did my potassium sparing diuretics. Actone, that's the ending. Spironolactone, spironolactone. That's the potassium sparing diuretics. So I kind of learned that. My thiazide diuretics, thiazide, that's the ending, and hydrochlorothiazide, that also used as a diuretics for patients that are like, you know, have high blood pressure, or even patients that have kidney issues. Some of them might be on here because they're retaining a lot of fluid, so so they'll give them like a diuretics. All right. So I have my anticoagulation medication like the heparin, the warfarin. I kind of learned the ending for that. I have my antibiotic, the cyclone, tetracycline, mycin, let's see, levofloxacin. So that's another antibiotics. So I just gonna learn a lot of these things. Even my bronchodilator, albuterol. I learned the ending, so when I saw it, I kind of knew what kind of drug that was. So like the benzodiazepine, so it's NCLEX and LAM, SSR for like antipsychotic medication. So I just kind of learned the ending of these words or these drugs, and I was able to pass my test. Let me see what else is on here. Steroids. Gonna learn my diseases like Addison disease. So I just put a little cheat sheet together to really help me. So when I went to my testing, I knew most of these drugs. So if I saw a drug that I didn't know, I knew it fell within. If it didn't fall within these drugs, I kind of knew, okay, maybe it's something else, and I can kind of guess. All right. So like I said, there was a lot of drugs on my test. There was a lot of calculations on my test. A lot of diseases. Let's see here. And I had a lot of questions about amputees, like patients that are, their legs are amputated. How do you elevate them? Do you elevate them, or you don't elevate them? So that was kind of weird questions, but for some reason I think I saw that on my UWorld, so I was able to answer that question. And also to learn your skills, like the wound care, or I didn't really have like a trach care on there, but I had wound care. I can't remember something else too. But I also, it was so weird because the amputation, I had a lot of questions on the amputee. I don't know why, but I did. And then they had like a lot of priority questions. Which patient do you prioritize first? Which patient do you see first? And it's always, what I always remember, even from nursing school, which patient will die first? If you don't do certain things, which patient will die first? So you always have to remember, what can I do to make sure I don't kill a patient? So that was one of the questions, a lot of the priority questions that I had. It was just about, again, which patient do you prioritize to make sure that a patient doesn't die? So I had that. Again, most of my questions was calculations. And I know a lot of schools don't really spend a lot of time on calculations, but take the time, go to YouTube, figure out your calculations. And every professor does it differently, or everybody does it differently. And I did mine differently, but I will try to do a video where I can just give you like few examples of how I was able to set up my calculations, and I was able to always get them correct. So do that, and also to like remember your vocabulary words, because you are definitely going to see them again. I keep saying it in all my videos, but man, it really helped me to answer some questions. But sometimes they will give you a question and there's a word in there you don't know. You're definitely not going to be able to answer that question because you don't know what that word is, and that word has a lot to do with answering that question. So learn your vocabularies, learn your diseases. You don't have to know all the diseases, just learn like maybe the top 10 diseases or the top 20. When you know them, then you know like, okay, this disease is this, or this question is asking for this kind of disease. So do that. If you do these things, I'm telling you, you will do really well on the NCLEX. Again, NCLEX is not trying to confuse you or just kind of, make it difficult for you. It's very straightforward, but it could be a little confusing. So just take your time and narrow all the questions or the answers down to two answers that you think that might be the best answer for the question. And then once you narrow it down to two questions or two answers, it'll be easy for you to figure out, okay, which answer is the best. And at least your chances of passing that question or getting that question right would be high. Yeah. So just narrow it down to like two answers that you might think might be the answer for that question. So if you do these things, hey, you will be able to pass NCLEX the first time. But again, I can't stress this enough. Really work on your drugs and your drug calculations, because that's the quickest way to kill a patient. If a patient, like, for example, their trach falls out, you can pick it up and put it back in, and they will live. Maybe they might get infection later or bacteria or whatever, but at least it will live. But if you give the patient a dosage that can kill an elephant, that patient's gonna die. Or if you give the patient a wrong medication, that patient's gonna die. So you just gotta be very careful on calculating your dosage or your drugs, making sure you have the right drug, making sure you have the right calculations. In the real world, you probably don't even need to do much calculations, but you still need, as a nurse, if I go to a patient's house, if I see a drug that is like, oh my God, this is 1,000 milligrams, and that just seems a lot, or 2,000, that just seems a lot. Then you can try to question it and say, okay, I don't think this is right. So you are the eyes and ears of the doctor when you go to your patient's house. So just make sure that you are calculating, or you're kind of looking at the dosage and the kind of medication for that patient. So again, I just wanted to give you these tips. This is what I had on my test, and I was able to like answer a lot of them correctly, because I was able to pass NCLEX at 85 questions, even though I was so nervous and the computer just shut off, and man, I thought I failed, but I was able to pass it the first time. So hopefully this video helps you to be able to pass your NCLEX. If you have any questions or other ideas, please let me know. You can put it below. You can subscribe to this channel. We are going to be bringing a lot of content to you, so please subscribe to our video, and good luck. And again, you can do this. Just go in there, relax, get a good sleep, and just relax, and you will be fine. You can say a little prayer first, but just relax and you will be fine. All right, I will see you in my next video. Bye. Thank you.